Carpal tunnel syndrome is a unique disorder in that there are many risk factors that can contribute to its development that are both occupational and non-occupational. The contribution of each risk factor individually is unknown as of yet. It is currently believed that there is a synergistic or additive effect that leads to its development. For example, if a job requires awkward wrist postures plus forceful gripping, the two together will increase the risk of development. Before work-relatedness can be established, non-occupational risk factors must also be examined. It's important to note that people with no underlying conditions can develop carpal tunnel syndrome. Also, people with underlying conditions can still have this carpal tunnel development impacted by occupational risk factors, especially if the condition is more severe in the dominant hand. Non-occupational risk factors for carpal tunnel syndrome include diabetes, hypothyroidism, fluid retention from pregnancy that will usually rectify itself within 3 months after giving birth, menopause, high blood pressure, arthritis, fractures or trauma to the wrist, lupus, birth control, estrogen replacement therapy, smoking, obesity, gender. Women have 3 times the risk of developing CTS compared to men. Age. Carpal tunnel syndrome will manifest itself between the ages of 40 to 70 in most people. An overactive pituitary gland, alcohol abuse, certain hobbies, poor nutrition, and a small carpal tunnel space. Occupational risk factors for carpal tunnel syndrome include force, repetition or insufficient recovery periods, awkward postures, vibration, prolonged pinch gripping, use of gloves that may be ill-fitting or not the correct type for the work being performed, contact stress, and cold temperatures. Prevention should include being aware of signs and symptoms such as numbness and tingling in your hands, especially at night. Report your condition to your Joint Health and Safety Committee so preventative measures can be introduced. Have an ergonomic assessment performed of your work area. Keep your wrist straight in a neutral position when using tools and equipment. Avoid awkward postures of the wrist, such as flexion, extension, radial or ulnar deviations. Avoid pinch gripping. Alternate from tasks that require high-intensity use to tasks that require less intensive use of the hands. Try differently designed tools that can allow for neutral positions of the wrist. Reduce exposure to vibration using anti-vibration gloves or anti-vibration sleeves that slide over the handles of the tool. Use gloves that are of the proper size and appropriate for the task being performed. And increase awareness of the disorder with education such as risk factors and prevention.